Good morning, mates. 16 minutes past 11. Otto here with you up till 2 p.m. It's the interview hour where you stand a chance to actually ask the guests on certain questions which is ailing you in terms of health, because today's topic is how hormones shape our health. And today we're joined in the studio by Dr. Malathi Karupiah. She's an internal medicine and endocrinology doctor. And of course, she has been in this line since she studied in 2006, got her medical degree over there. She has both Masters of Internal Medicine and also a membership from the Royal College of Physicians as well. Thank you very much for joining us in the studio today. Thank you very much, Doctor.
Thanks, Otto. Thanks for having me.
Now, my first question is, off script, why? Why endocrinology?
Okay, good questions. Firstly, I think a lot of people don't know when I say what I am, endocrinologist. Firstly, to even pronounce it seems to be a problem as well. But it's a study about hormones. And if you look at it, our whole body is actually functioning when our hormones are all stable. Mm-hmm. So what I would say is it's good. I'm very interested in solving puzzles. Mm-hmm. So most of the time, the basic is basic. Any patient comes that are ill and a lot of things that we are not sure what's going on, we kind of go into it. We are the people that they call, and we are looking at not only numbers, we're looking at everything physically as well, and then try to come to a diagnosis before we send them to any other subspecialty that needs any intervention.
Wow. So once again, we are talking to Dr. Malathi Karupiah. She is an internal medicine and endocrinology doctor. And if you want to talk to us, please do so. We are live on Facebook. That's TRAXXfm OFFICIAL. Also on TikTok. So head over there. Leave your comment if you have any questions with today's topic, which is how hormones shape our health. Now, without further ado, Doctor, please enlighten us. Can you explain what endocrine health is and why is it very important for overall health well-being?
Okay, that's a very good question. Just to sum up, basically, it consists of multiple. Our hormones are all produced by glands. That's all around our body. And we have something that is what I like to just tell my patients, that is the motherboard. So motherboard is the one that's mainly functioning all our body systems. So it starts with the head, where we have a gland called the pituitary gland. It's a very, very small little gland that starts secreting all these hormones. And it starts then stimulating your thyroid gland, which is situated at your neck. And then for females, you have your ovaries, which produces your eggs, and for men, testes. So these are the few things that it actually, all the glands that are producing and making sure our body is stable. Similarly, now you are hearing a lot about diabetes as well. We've got this beautiful gland situated just in our stomach called the pancreas. This is another gland that actually produces insulin. So if there's dysregulation of any of this, then there are diseases such as diabetes. You have hyperthyroid, meaning your thyroid are over-secreting or under-secreting. And then it comes with the obesity issues and whatnot.
How long does it take to actually, since you like to solve puzzles, how long does it take to actually identify the issue at a patient?
Oh, because this is bread and butter, sometimes it's as quick as,
Wow.
just looking at it. It's just looking at numbers and, putting all the symptoms together, we will immediately get the diagnosis. Sometimes you'll be surprised even when a patient walks into the clinic. Sometimes we even can look at them physically and know,
Wow.
kind of gauge what they already have.
I'm curious what you're going to say about me.
So far looking healthy, Otto.
Oh, thank you so much. Whew. That's a burden off my chest now. Is there any difference between men and women hormonal well-being?
Yes, I would say so. I think as much we talk about equality, when it comes to hormones, it's not equal. We have women, which now we are talking quite a bit about them going into menopause or perimenopause. So, there's decline in their hormonal levels as age progresses. In men, most of the time, they have the main hormone that's called testosterone, and it's constantly there. But unless you develop certain diseases that can kind of affect it and kind of drop the levels. So that's when then they will actually come to seek for our help as well.
So it doesn't deteriorate in terms of men's testosterone, is it?
If you have diseases,
Unless you have
it can.
disease.
Yeah.
Women?
Women, yes, it can as well. So it really depends what it is. But menopause is an aging process.
I see.
So it actually happens. There's no, there's no stopping it. It's going to happen for every woman.
I see.
So I think that's the biggest scare when it comes to that.
There you go. So if you're scared about something, the good doctor is here. According to one of our TikTokers says, wow, so beautiful, this doctor. Yes, she is very beautiful. And you should learn from her how to take care of your health, take care of yourself. Very important. We have Nelson Charles says, hello, good morning to you too, and other people as well on our Facebook. We're going to get to your questions in just a bit. But first up, doctor, what role do hormones play during pregnancy, and how can hormonal imbalances affect expectant mothers?
Okay, so going through pregnancy itself, before you actually get pregnant, there's a lot of hormones need to be stabilized. And of course, now you have all the issues of infertility. That's a whole big topic on its own. But just to summarize it, pregnancy, when you get pregnant, ladies, they go and check their urinary tests. I'm sure a lot of fathers and mothers are listening. So when they check, they're actually checking for a very specific hormone when they're checking their urine, which is called beta-HCG. So this is very much elevated in women who are actually pregnant. So when this is elevated, so we endocrinologists don't like anything that's very elevated or excessively secreted. But when this is elevated, it's good in a way that we know that a patient is pregnant. But at the same time, it can disrupt your other hormones, especially your thyroid, because it has a mimicry effect that can cause the thyroid levels also to be elevated. So sometimes some mothers are referred to me because they have all the symptoms of excessive thyroid levels, such as, sweating, tremors, palpitation, heart rate suddenly goes up. But that's because they are vomiting. The whole reason why early signs of pregnancy is vomiting is because of one of this hormone that's extremely elevated in them. So that's the cause of it. So similarly, you kind of need to go for your proper checks. Nowadays, I kind of tell all my women to get a booking very much earlier itself. And if you have any risk factors such as obesity or family history of diabetes, I think it's so important that they get themselves booked early. Some women, I've realized that they wait for after maybe in their second trimester. That means that's after 12 weeks of pregnancy, and then only they go and book. But sometimes it's a bit late because we don't know. We notice sugars are either high, their thyroids are high, and we need to kind of then come in place, admit them, and do all sorts of things.
And they don't do any health checkups before that as well, which is also another issue.
Yes.
They don't look up to the doctors and check on their health.
They're very scared,
I
Otto.
see.
They're very scared to come and see us. We don't bite. We are all here to actually just help them. But I think a lot of us humans, we don't want to know. I think the knowing is what is scaring all of us.
They want to be ignorant in terms of their health. Only when it happens, it happens.
Yes.
A big burden for you doctors as well.
Yes.
Well, anyway, we're talking to the good doctor, Dr. Malathi Karupiah. She's, of course, an internal medicine and endocrinology doctor. Mouthful. Sorry about that, doctor. If you have any questions, please post it on X, or possibly also on TikTok and also on Facebook. We'll get to your questions very, very soon. Alternatively, you can give us a call at 03-2282-5491 or 03-2282-4746. We're talking about, of course, hormones shape our health and how it does. So keep it locked tight right here on Traxx. We're going to take a short break and we'll be right back with the good doctor in just a bit. For now, Lauren Hill, Can't Take My Eyes Off You, right here on Traxx. Good morning, Alicia. morning, Malaysia. 27 minutes past 11. Otto here with you till 2. The interview hour, of course, where you will actually get the opportunity to talk to our experts in the studio right now. We are also live on TikTok and also on Facebook. So you have any questions, we will get to it. Alternatively, you can just give us a call at 03-2282-5491 or 03-2282-4746. Now, we had a caller earlier on which asked the good doctor with regards to hormones as well. Now, is it possible that an individual can get pregnant after menopause? And what are the possibilities of that?
All right. Good question. So menopause, if I may define it, is in the average, we take 50 years old. And when you hit menopause, is basically cessation of your stoppage of your menses for 1 whole year. So what hormones are we lacking? We are lacking estrogen and progesterone. So when you talk about pregnancy, you need these 2 hormones, which are very important to actually sustain a pregnancy. So there are, I would not actually recommend it, but I think there are some cases women have gone through pregnancy after the age of 50. But honestly, I think it's more of assisted. Mm-hmm. So assisted meaning they've probably gone through IVF, where they get assistance from doctors of injecting them estrogen and progesterone or whichever hormones that they need. But honestly, I think we have to see the bigger picture, whether after the age of 50, all of us know, and we've seen it with our mothers as well, where they become very tired, frail, and to go through 9 months of pregnancy, I think it does take a big toll, not only physically, mentally, but emotionally as well. So I think if someone is going to go through that, they have to be very, very sure of what is it that they are putting themselves through.
Mm-hmm. So thank you very much, Norabel, for that question, which you called up earlier on. And of course, it's an isolated issue as well.
Yeah.
Yeah. So anyway, moving on, hormonal changes during menopause, right, can actually be challenging. What should we be aware of during this phase?
Okay. Very good question. It seems to be a very, very hot topic right now everywhere when we speak about menopause. I think if I were to give a life example, a real life situation where I get a lot of women coming and telling me the very, very same sentence, which alerts them that they need to come and check their hormones. And they say, doctor, something is wrong. I don't feel the same anymore. And what are the changes they feel? They might be someone who are like the type A's, meaning, they are go-getters, they're holding a very big position in a corporate field or anything, but suddenly they start thinking twice and questioning their decisions. People who are able to do solo trips previously are now worried to do it. They're scared. They get palpitation at night. They suddenly feel like, suddenly it's like hot flashes. And hot flashes, it's very, very distinct here. It's always at the upper body. And they feel very tired. And of course, you have the perimenopause. That means these are the first 10 years before the age of 50. You feel similar, but you still have your menses regularly. So I think it's very important. Number one is to have self-awareness. And it's good if you hear talks on this and just getting to know and read up on this of what are the changes you need to look at. And one thing I always advise all my female patients is to have a diary, a menstrual diary from the age of 35 itself. Making sure that they're jotting down every month when is their cycles, how long it lasts for, because that kind of tell you if it's shorter, if it's longer, it's prolonged. These are telltale signs of you needing to come forward and getting either the gynecologist or the endocrinologist checking through your hormones and seeing where you stand. Mm-hmm. Yes, everyone is so scared. They're like, oh my God, the minute, I hit menopause, am I still a woman? Because it's a big thing. I always say, estrogen is our superpower for the women. Testosterone is like for y'all. So we have that high enough that's preventing us from actually having any heart attacks or any dementia and all that in the younger age group. But the minute we don't have that anymore, we are an open door for so many diseases. So I think just embracing that it happens throughout the aging process and coming forward and getting, an early consult with your respective doctors.
Now, if you've just joined in, we're talking to Dr. Malathi Karupiah, consultant endocrinologist from Prince Court Medical Center. We're talking about how hormones shape our health. Now, hormonal imbalances affect metabolic health and weight management. Is that correct?
Yes.
Now, how does this affect us now? There's so much things.
Yes. So again, as I said, endocrinologists, we deal with a lot of things. Mm-hmm. I get a lot of patients coming to me for weight management. So now obesity, as you know, Malaysia is number one right now in Southeast of Asia with the highest number of obesity patients. Firstly, I always like to ask my patient if they think they have a weight problem, because it's so important. Number one is to have the right mental state if you want to go through down that lane. So second thing is we always look for any hormonal issues, especially the commonest is thyroid. So thyroid, if it's accelerated, that means overactive gland, tends to make you have unintentional weight loss, which is unhealthy. That means you have tremors, palpitations, and whatnot. But if you have underactive thyroid gland, this is where you might be eating a little, but you notice that your weight is just, just going up so drastically within a couple of weeks. Even it can be a month, and you're thinking, what am I doing wrong? I'm doing the exercise, I'm eating right, healthy diet, whatnot, but still my weight is going up. And then you have so much of water retention. So this is something where we will always look for, looking at your hormones, whether this is what is causing you to have weight gain.
So those are, you'd say, common signs?
Yeah, those are. So if, like I mentioned, if it's an underactive gland, it's more of a weight gain. You have constipation. You have hair loss and dry skin, and sometimes even cold intolerance. We have a tropical weather, but when you're outside, you feel extremely cold.
Yeah.
So this is a telltale sign as well.
Okay, we're talking once again to Dr. Malathi Karupiah, consultant of endocrinology, Prince Court Medical Center, talking about how hormones shape our health. So once again, if you have any questions to the doctor, give us a call at 03-2282-5491 or 03-2282-4746. Alternatively, you can head over to our X account, our Facebook account, and also TikTok account to cast your question, of course. So looking at some of the people that we have Christina Sin says, good morning, Doctor and Otto. Good morning to you guys. Shirley Kia, big shout out as well to, let's see if we have FXGHLXX, and then we have a lot of people online as well. Serena, thank you so much for the love. Dolls DC116. So once again, if you have any question, you can post it there online right now. Now, Doctor, those are the common signs of hormonal imbalances that people should look at into. Now, how long does it actually take for you to, identify that person to be having some issues with their hormones?
I think number one, it's history taking based on whatever they tell us, signs and symptoms, how are they feeling. So it kind of tell us in the beginning itself, what are we looking for? So after that, it's just blood taking. We do a simple blood taking test. We check your hormones and see whether that kind of correlates with the symptoms you're feeling. Mm-hmm. At the end of the day, whatever we are doing, especially women who come to me for, perimenopause, menopause, what I'm doing is just eliminating if there's anything that I need to intervene. Most of the time there is. It could be as simple as just a thyroid problem, or it could be even early signs of diabetes. They have unintentional weight loss as well. So these are the things that we look for, and we kind of correlate and treat the patient accordingly.
There we go. So we're talking once again to Dr. Malathi Karupiah, and our next question is with regards to Ramadan. So if you have any other questions, let us know through X or probably on TikTok and Facebook. We'll get to it in just a bit. But we're going for a little short break, and we'll be back with a good doctor in just a bit. No. Good morning, Malaysia. It's, of course, Otto here coming to you live from Angkasa Puri, Kuala Lumpur. And today's feature interview has to do with something about hormones. So head over to our, of course, TikTok and Facebook. We are live right now. So if you have any questions for our good doctor here, you can always post it there or just give us a call 0322825491 or 0322824746. We're talking to Dr. Malathi Karupiah. She's, of course, a consultant endocrinologist from Prince Court Medical Center. And I did mention with regards to Ramadan. So, doctor, the first question I want to ask you here right now is how does fasting during Ramadan impact hormonal health and balance?
Okay, that's a very good question to ask during this time, actually. So firstly, I think I would want to address all my diabetic patients and any diabetic patients out there. During fasting month, be very, very mindful of, how are you actually doing your sahur? What are you actually eating during sahur time? And of course, throughout the day, you're fasting, so you're depleting your body from any food and any water. So what can happen is sometimes, you can overstress your body in the first few days. So be very careful of not doing anything what you have been doing. That means your routine have to change during this 1 month. Not any heavy activities. If you're constantly under the sun, be very mindful not to be under the sun as much as you can. What changes is your insulin is actually one of the hormones that changes. So most of the time, we are actually encouraging people to do something called intermittent fasting. But during Ramadan time, most of our patients are fasting 14 hours. Intermittent fasting, if you do it correctly, is 16 hours. So it's just two hours extra, except you are unable to, during that time, you actually can drink water compared to Ramadan. So fasting, in a way, is good in a short period of time. It actually regulates your insulin. So these are the time where I always see all my Muslim patients, at least 2 months before Ramadan, if possible, and regulate their medication. Because when you're not eating much, your insulin secretion is not that much. It kind of like comes down. So we cut down the medication as well. We sort of like, all their insulin, if they are on insulin or if they are on any oral medication, we cut back during this 1 month period. So very important, please go and see your doctors, whoever's prescribing you the medication. Ask them to regulate back the medication during this time. When you're actually opening your fast, iftar, be very mindful as well. Don't go and take such high sugar content. I get scared when I see a lot of, things being sold with full of condensed milk and, it all looks yummy and nice and sweet and you have all sorts of all this
Cravings, yeah.
Yes, and, you suddenly you have this surge of, wanting to go and eat everything. But then you realize you eat and then that's it. You don't feel like eating much. This is, halfway through your Ramadan. But be very mindful because this is going to shoot up all your insulin. And what insulin does excessively, it goes and store and become fat.
There we go. So she said it. I didn't say it. It becomes fat. So watch what you eat, people.
Yeah. So be very careful. As much as people think, okay, the fasting month, I'm going to lose weight. Then you come and check your, weight and you see, hey, how come I'm not losing? I might have been losing just 2 kgs. That's water weight, people. It's just not your fat that you're losing. So be very mindful. So these are a few things that I would suggest people to be a bit more careful and aware.
I would say the same thing as well when it comes to your spending. Recently, I went to the Bazaar Ramadans and I just said, okay, 50 ringgit will be enough. But no, I spent 100. No, we tend to overspend and tend to overeat as well. So please watch what you're eating because you are what you eat as well. Now, looking at the question which we have on TikTok right now, one of our, online people are asking, Doctor, what is the hot flashes only in the face? Is that the symptoms of menopause?
So, as I mentioned, hot flushes is very, very subjective. There's 2 things. It could be even a thyroid issue where you get very much heat intolerance. But that usually, it consists of the whole body being very, very hot. Hot flushes, if you look at the definition itself, it's actually from chest above. So you're only feeling around the face region or the chest region. And women will know this. They really, really feel completely hot. And they feel like, sometimes they need to stand under air condition or something. Okay. So that is the difference if you want to talk about specifically in menopause.
So there you go. Thank you very much, Doctor. And thank you very much for posting that question. Now, my next question is, what are some specific hormonal shifts people experience during Ramadan and how can they actually manage them?
Yeah. So as I mentioned, insulin is one of it. The big thing that actually shifts. You also have, your appetite hormones. If I be very medically inclined, there's something called leptin and ghrelin. So these are all your hormones that suppresses your appetite, and then it also causes you to have hunger. So these are the ones that will be affected during Ramadan time. So if you notice, sometimes after 2 weeks of fasting, when you start having your iftar, you wouldn't want to eat as much as you were in the beginning, because your body has adapted. One thing, if I may say, our body is beautiful on its own. It's smart.
Yes.
It can adapt in every way possible naturally as well. So I think sometimes it's just listening to your body, what it wants, and not overdoing it. So always eat in moderation, even though you're not fasting.
No, there you go. Lastly, before we let you go, doctor, what dietary lifestyle recommendations would you suggest?
Okay. So I truly believe when people talk about 80% food and 20% exercise, that is very true. Your body is your temple, right? So always we need to take care of our body. We need to know what we are putting inside of our body as well. Similarly, I think it's a holistic approach. It's about physical, mental, and emotional. As much as a lot of people coming for weight loss, consult and all that, I think it's very important to also address if you're in the right state of mind to go through the whole weight loss journey. It's not a temporary fix. It has to become a lifestyle. Hence why the whole terminology of it's a healthy lifestyle. It's just not looking at food, but also, you need to burn whatever you're eating, right?
Yes.
So you have to also do your exercise, because movement is what's going to help us in the long run. And exercises such as cardio is good in the beginning, but I would always say, you need to do your stretching such as yoga, Pilates, because at the end, we have, our joints that is our mobility, helps with our mobility. So if we are not doing much movement, it's going to be very, very restricted. So that's where falls can happen, fractures can happen, and, you can probably sometimes just spontaneously tear a muscle, a tendon. So yeah, eating right and also doing the right exercise that suits your body.
So please be mindful of your health, watch what you eat, and sleep accordingly as well. All right, so doctor, message to everybody listening in right now.
If I can say one thing is that I think all of us just kind of need to have start practicing self-awareness. I think that's something personally I have come to do for a long time already. And I think that sort of kind of give you the right intention in regards to having a good lifestyle, and also making sure that, you don't sort of like drift away from being in the right part of, sustaining a good lifestyle, having a good routine, being consistent and being disciplined, two things that most of us always tend to lack on. I think this will keep us on track.
Well, thank you very much. We're talking to Dr. Malathi Karupiah, consultant endocrinologist from Prince Court Medical Center. You know where to find her if you need any consultation with regards to this current issue. And, of course, thank you so much for those who are online. Just want a quick hello to Raifi Lee, Shirley Key, Najib Dawi, Dulce, and all those who are currently online. Thank you so much for joining the conversation and liking the live as well. So we will be back for tomorrow next interview as well. So once again, thank you very much, Doctor, for coming to the studio.
Thank you.
And then we're going to break for a short while before we bring in the news. So stick around right here on Traxx, leaving you with Oasis. Don't look back in anger right here on Traxx. Good morning, Malaysia.